Doreen 𝗔𝗓𝗢𝗃𝗧 is the
Dr. Doreen is an expert in autism.
Doreen 𝗔𝗓𝗢𝗃𝗧.
Dr. 𝗔𝗓𝗢𝗃𝗧.
Dr. Doreen 𝗔𝗓𝗢𝗃𝗧.
Dr. Doreen 𝗔𝗓𝗢𝗃𝗧 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. She says, how do I increase my son requesting in regular conversation, not only when he needs something?
So that's, so let's talk about that. So usually we request items when we need them. I think what you're referring to is asking questions about things. That's not really in the language of ABA called requesting. It's just called asking questions. Because requesting is a very important thing. We only request things we need or want. And that's called manding. And it's a very important stage in therapy because it is its own reinforcer. When you request something, you generally will get the thing you wanted, right? And that's only true of mands or requests. Every other type of communication has a reinforcer, but it's a different type of reinforcer. It's not as direct. So the next stage in language for behaviorists is tacting. And tacting is where you comment or point out things that you see in the environment. So this is the typical, let's say, 3-year-old in the back of the car, you know, as you're driving, and they're like, oh, fire truck, you know, whatever, and they're pointing out things that they see in the environment, or on TV, for instance, you know, and they're naming things. And the reinforcer for that is usually a parent or someone else being astonished at how amazing this person is, and they're starting to label and all that. Another reinforcer for tacting is that when you tact, you're actually using a part of what's called joint attention. Yes. So you're sharing with someone else what's in your mind, right? And you're saying, oh, look, I see like Rosie on the TV, and Mom, look what I see. And then the person joins you and says, yes, isn't that great, or wow, or something like that. And that is reinforcing for typically developing kids. A lot of times with our kids, they're not able to experience yet, at that age, they're not able to experience kind of the joy of sharing a bit of information with a parent, or it's not as rewarding to them if the parent just says, okay, yeah, great, you saw a fire truck, you know, or something like that. So joining together with the parent and that interaction has not yet become rewarding for the child. So when your child, so to answer your question, Dr. Angel, the next step is to start asking your child what they see and just labeling objects, and then making sure that you dramatically reinforce the child for labeling things in their environment, not just things they want, but things they see. And so just having that alone will really, really expedite and get your child to the next level of conversation, which is tacting. The next level beyond tacting is then intraverbals, which is having some sort of dialogue or expression of information about objects that are not necessarily present or in view. And that's a kind of a little bit more advanced. In the meantime, in order to get there eventually, you need to work on a lot of different things. Like, we're not talking about just object labels. Like, for instance, things that your child could also tact about are people doing things, right? So like running, jumping, kissing, so action objects, action labels, and also describing things a little bit more deeply. So for instance, teaching the child attributes that go with either the action or the object. So like, you know, the red truck, the blue car, or big truck, or, you know, small cat, or whatever it is, but attributes. And that's how you start to expand language, is by teaching, you know, different aspects of it. And in typical development, when the child, if the child was more able to focus when they were younger, and they weren't dealing with all the issues of sensory inputs with autism and so on, they would have picked those things up gradually on their own. Now you're tutoring, you're catching them up. So now you want to teach those lessons individually. So objects, actions, attributes, and you keep doing that, prepositions, pronouns, and then you join them as you go forward, and that's how you develop language. Takes a while.
It's making me very emotional, this conversation, because we have another question coming up from a parent about interverbals. And Philip, I want to let you know that I see your question. I'm going to get to your question in just a second. But I remember, as you were talking about this, I remember the day that I was very pregnant, and we drove over a hill into a shopping mall, and they had a carnival, and there were balloons everywhere. And the baby kicked, my son kicked, and I turned to my husband and I said, oh my gosh, in like a year and a half, there's going to be a little voice in the back of the back seat who points and says, balloon, balloon, right?
Wow.
And we were like, oh, we're having a baby, And then the irony was that I didn't have a baby who said that.
Yes.
And the pain of that, that we had to teach him how to say balloon.
Absolutely.
And I remember when he was 2 and the pain of going, my child isn't going to do that.
Yeah.
Right? But then I remember a year and a half later, as we drove around and looked at the Christmas lights with my mom, that he would go, whites, whites, right? But then I remember the pain of, okay, we have that. So when will we get to the point when I ask him a question and he can answer that?
Yes.
And that each step along the way, as parents, we feel the pain of where we are. I just want to say to everybody, remember, we got there.
Yeah.
And that's a possibility for everyone, that, to work towards getting to the place where you want to get. But I also want to remind you to celebrate each step on the step to where you're trying to go.
Yes.
Because I so wanted him to say balloon and felt the pain of that when he didn't. So when he said whites, I tried to celebrate it as much as possible, but I honestly, what I did was I went on to the next thing to worry about. And I don't want that for you guys.
Yeah.
So remember to celebrate the things as you go, and to trust that you're doing everything that you can to get there.
Yep.
Otherwise, the anxiety will eat at you.
Yeah,
And you miss it. And there are times that I look at him now, and all I want to be able to do is turn back the clock to when he was 3 and worry less.
Yeah, I hear you.
Because we still got there. So it makes me very emotional for you guys, because I feel the pain of where you are.
Yeah.
But I want to send you hugs and remind you that, these are things to be learned.
Yeah.
And that, if you keep working on them, you're going to keep making progress. And we talked about this yesterday, that if progress isn't being made, that you look at that with your team and go, why, and go at it a different way.
Yes.
So that you get to the progress. So I just was having an emotional moment.
No, I
remembering
understand.
it all.
I understand, Shannon, and it's really, I appreciate you allowing us to kind of share that with you, like see it from your perspective. But I want to tell you, as a parent of 3 neurotypical now adults, I often have the same feeling.
I'm sure.
So parents in general, I think that's one of the reasons that we say we love, it's more fun to be a grandparent.
Yeah.
Because by the time you become a grandparent, those anxieties are gone, right? You're just having fun now. But as a parent, I was a lot the same. I would worry about pretty much everything, like my kids were growing up bilingual, if not trilingual, and of course, so their language was delayed, like with my son, and I was panicking at age 2 and like setting up logbooks for him and having like everyone in the family sit down and work with him. So I get it. It's not at the same level, but I totally overstressed. I think as parents, good parents tend to be anxious, because if you didn't, if you weren't anxious, you would be doing less. Yes. You know what I mean? The anxiety also makes you the doer, and it's a cycle, right? So if you didn't have anxiety, you probably wouldn't have done 40 plus hours of ABA.
Yes, no.
And so it has its own function. And so, we look back and we miss it so much, because we just want to have that moment of just enjoying our kids, and they grow up so fast.
But you know what? I think I just had another epiphany, because I do think that parents of neurotypical kids have a lot of the same anxieties. But you know what the difference is? I think for all of us that at some point, somebody who called themselves an expert took away our certainty.
Yeah.
That they said, your child has autism, so I don't know what's going to happen.
Yeah.
I don't know if your child's ever going to be potty trained. I don't know if your child's ever going to speak.
Yeah.
I don't know if your child's ever going to be able to
It
work.
doesn't even take that. Like a lot of parents, you don't even need an expert to say that to you.
The world says that with the diagnosis.
Yes.
And so then there is this thing about, I'm not sure.
Of course.
If we're ever going to get there.
Of course.
And you feel like that's been verified by somebody who probably knows what they're talking about. Whereas I think,
you're right.
I don't
You're right.
know. I think for neurotypical,
You're right.
until an expert says that you're like, I'm having anxiety about this, but someday he'll be 22 and he'll be speaking and he'll be driving a car, right?
Right.
Whereas when my son was still 14, I still was like, oh, I don't know. I don't know what it's going to look like.
That's right. And I think that is what I was going to say. Yes,
Yeah.
and not knowing where you're going to end up.
Yes.
Yeah,
Yes.
and it's not
the uncertainty of it all.
The uncertainty of it all, and it's like, I remember reading those books, What to Expect When You're Expecting, and then What to Expect 1 to 3, What to Expect at 5, or whatever, those books. And you always panic because you're thinking like, oh my God, my child is like not doing this yet. But I can imagine that for a child, for a parent whose child is maybe 2 years behind or 3 years behind, it's way, way, way more anxiety provoking. And absolutely, I mean, as we know, at least half of the kids on the spectrum don't actually get to that point. So there is that. And realistically, we have not yet figured out exactly how to help everyone get there.
Yes.
But
all kids make progress.
All kids make
progress. Even the most severest of the kids make progress. It's just that they make progress in different areas and at different rates.
And the ones that, the kids who have the hardest time making progress are usually, the reason is because of some medical, physical issue. You know, a lot of times they have other illnesses that are so severe that are just preventing them from being able to use their mind the way that they could otherwise.
Absolutely. I want to thank everybody for people writing in. Philip says a gratitude journal can be helpful. Andrea said, Shannon, I'm in tears because you've described my feelings to a T. Let's hug it out. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.